any awareness. This is a totally a novel virus. None of us have got any awareness of this particular thing. So people were completely afraid, totally afraid. So to come out even, I mean, to be frank with you, we had many, discussions, arguments within the gated communities to allow this, to not to allow that. And we have obviously a lot of apprehensions, maybe myths also, because, there are some myths, if you do certain things, we may get infected. So we need a lot of education and awareness, particularly to RWS, because these are little different compared to outside. So, I mean, I once again thank all the doctors for taking this initiation and coming forward to help us, to empower us with the knowledge, to burst the myths, whatever we have, to remove our apprehensions, to give us guidelines and suggestions. I really thank all the doctors once again. You please take forward, because there are so many questions forwarded by our residents as well as the L&T residents. I request you to take up all the Q&A first, and then you can give us any suggestions also, based on that, which we can implement in our RWS. It becomes very easy for us. We have expert advice. It becomes easy for us to implement these guidelines also. So it would be great, if you can give us the final tips, to implement in RWS. So I request the doctors panel to take over for Q&A first, and then you can give us any suggestions, specific suggestions to RWS. Yeah. Thanks a lot.
Thank you, Nagaraju Garu. That I can understand the tussle that is happening everywhere, and this is not just Sarovar or L&T. It's a tussle everywhere, and I think it is a good tussle, because as a community we are becoming conscious and taking responsibility. But we have to have a uniformity and collectively take decisions. And I think more than control, collaboration would be important, and engaging everybody would be important. And I really appreciate both Serene County and Aparna Sarovar Association Welfare Association for coming forward and taking this up. I just want to, before I call in Hemant, there are a lot of people who are asking about unmuting the mic. Please type your questions in the Q&A chat box. We will take those questions at the end. We have some registered questions which people have put up on the Google form that was shared yesterday. So we will take those questions first and then come to your question. I'm hoping that many of your questions will get answered in the process, but if it is not answered, we will take those questions in the end. And in the end, if there is some comment, some suggestion, we can always open or unmute the mic. People can raise their hand and we can unmute the mic, because it was a large gathering, so it's not possible to unmute everybody's mic in the start. So Sanjeev, I request you to initiate, give your short presentation and set the tone, and then we will take the question and answers.
Thanks, Rajan, for introducing the topic. We have been thinking about this session for quite some time, and I had informal discussion with several residents of Serene County, the place where I live. I thought one day we'll try to organize such a session, and it so happened that it came from Rajan, another colleague who lives in Aparna Sarovar, that we can organize such a session. I said we have the capacity, so we can organize one session for both townships, and in one shot we can actually reach out to more residents. So that was the whole premise. So I am starting with a small presentation. I have given a name called 10 Commandments. And the precise reason for putting these 10 statements which I put in my presentation is something which I observe on day-to-day basis. I am in this society for several years now. Know a lot of people, I have good friends around, and there I see certain behaviors, and that kick-started that while it is important for us to satisfy your questions, your queries, can we begin something with can we begin with something which is, shared with everyone as some broad statement, so that remains kind of, a background for all of you. So that's the whole reason, or putting this presentation. Otherwise, the original format, what we thought, was about starting with question and answer straight away. So thank you, everybody. So we'll begin with this presentation, which I named as the 10 commandments. So that's on the famous movie 10 Commandments. Hope you will like these slides. So my first statement is about this virus. There is a lot which is unknown about this virus, what we call the coronavirus. On 31st of December, this virus was reported for the first time by Wuhan Municipal Health Commission, China. And on 30th of January, WHO, World Health Organization, declared COVID as global public health emergency. It's more than 5 months since this virus was discovered, and we still know very little about this virus. Researches are going on across the globe at unprecedented speed and at unprecedented level. What is true today may not hold true tomorrow, because by that time some new research will come. So many of the statements which my colleagues are making today, take it that this is the best available evidence today. Tomorrow, if we have a new evidence, we'll be sharing new piece of information. This is what we call as a science. In spite of moving with such a speed, we are still far from the solution which we all are looking for. That's my commandment number 2. We all are equally vulnerable. We all know that this virus is caused by novel coronavirus. This is a new virus, what we call as a novel virus. So none of us has any immunity against this virus. Therefore, each one of us is equally vulnerable, be it male or a female, be it a child, an adult, or an old man, be it Mongoloid, or be it Caucasian or a Negroid. Everyone is equally vulnerable for this virus. Children don't have any immunity against this virus, and so the adults. I see in my society a lot of teenagers. They talk to each other, they sit close to each other, they play with each other without any mask, without keeping any physical distance. I see a lot of men and women when they walk on road without any masks, without keeping safe distance, what we say minimum 3 feet and preferably 6 feet. And it looks like after seeing them that for them everything is normal. So what has changed since 22nd of March? That was the first day when lockdown was announced, and within a week, within few days, we saw a very, very strict observation of lockdown. So what has changed since then? The agent is same. What it was on 22nd of March is the same agent. Its virulence is same. It has not changed over last 3 months. Our immunity level is the same what it was earlier. We were neither immune that time nor we are immune today. There were hardly a few hundred cases on 22nd. Now we have cases which are more than 2 lakh. So our chances of getting an infection has increased substantially. On the contrary, our behavior has changed as if nothing has happened. everything has come to normal. So this is something which is troubling me. So that is very important for all of us to understand that we all are equally vulnerable. My number 3, the statement or the commandment is, masks are effective if everyone wears it. We see a lot of people who don't wear any mask and they walk on streets. We saw people sitting close to each other talking. Some of us, they wear mask without covering their nose. Some will just cover their nose, they will leave their mouth open. Some will just put on their chin, and for some it is just around their neck. This is how people wear the mask. So what is important in this case? The commonly used mask, what we call as a fabric mask, they are primarily not to protect one who wears it. It is to protect the other people. If I am wearing mask, I am stopping the virus spread. It remains inside my mask. It remains on my body. It remains inside my body. If you are not wearing masks, you are a threat to others. You are spreading mass, you are spreading virus everywhere. So masks are effective if everyone wears it. The probability of transmission is high if some of us don't wear it. And this is very clear from this graphic which you see here, that if one wears, what happens, if two wear, what happens, if both wear, what happens. So your transmission chances becomes very low. And often we don't know on which side we are. Are we on left or we are on right? So therefore, the only way we can secure it by wearing masks, following it universally. I mean, that's my next commandment. You may practice precaution 99% times, but it takes one mistake to get infected. And this is what we often see about, this is said about terrorism. I remember that terrorists have to be lucky only once. The same is true for this virus as well. You may practice precaution 99 times, but takes only one mistake to get infected. This could come through anything: your mobile phone, your car key, your wallet, your currency notes, the paper you are receiving, or a pen. You met someone, shook hand, you talked to someone who was very close to you, your very close friend, someone you feel is just cannot get any infection, because you do not know who has the infection. So it's important that we understand that we continue to follow the precautions which we have been observing 6 weeks before or 4 weeks back. My commandment number 5, leave statistics to epidemiologists and planners. There is a very interesting saying on statistics. It was a Joseph Stalin who said that a single death is a tragedy and a million deaths is a statistic. And epidemiologists will be fine if there is a mortality due to any infection is between 2 to 3%. However, for an individual, this is either 0% or 100%. There is nothing like 40% or 30% or 10%. Okay, I'm 10% alive, I'm 90% dead. It cannot be. It is 0% or 100%. Therefore, for individuals, they have to exercise utmost precautions to protect oneself, his or her family. This is commandment number 6. Avoid 3 C's. And these 3 C's are closed spaces, crowded places, and close contact settings. This is an interesting concept which came from Japan about COVID-19. They used it for the first time. The 3C concept or 3C strategy. On the right side, There is a graphic where you could see that a lot of people are sitting in one room close to each other. If they belong to one family, fine. If they don't, then they should not sit. Then there's a crowded place. And lastly, you could see there are women who are standing each or sitting each other close to each other, and they are talking without using any kind of mask. And interesting is part of this, if you look at the bottom, which says the risk of occurrence of cluster is particularly high when the when three C's overlap. Can someone just, thank you. So there was some vibration. So this is very important. We should avoid these three C's. And I already partly addressed in my previous slide why it's so important for us to follow the three C's. And this is something which we can make as a rule in our society, in our counties, in our residential colonies. If symptomatic, isolate yourself, report on Arogya Setu or T-COVID-19 app. So if in any situation, if you have certain symptoms which are suggestive of COVID-19, for that matter, any kind of influenza-like illness or ILI, you should isolate yourself, if possible, within your home in one room with separate kitchen, separate washroom or a toilet. Don't meet with other family members. Use medical mask as much as possible. But this is what my commandment number 7 is, that you should isolate yourself. Report on Arogya Setu or T-COVID-19 app. This is how the system would come to know, and it will kickstart. What is important for us, not to stigmatize anyone if someone is diagnosed with COVID-19 positive. We all know we have to live with this virus. That does not mean that I should be the first person to get infected. We need to keep our infection rates low. We need to see that our facilities, they remain available for the most needy ones. We are very lucky ones. We have large houses. We have separate rooms for all family members. We can afford to put one family member in one room and can still observe isolation. That's number 8. While masks are important and very important, but more than that, that we need these 6 critical public health measures to be practiced continuously. And those are, I'm sure most of you are aware of those. Physical distancing, we used to call it social distancing earlier, we changed the word now. Hand hygiene, we should keep our hands clean as much as possible. I just would like to add that even if you are at home, you should wash your hands a couple of times with soap and water. You may have virus inside your home, but if you continue to observe hand hygiene, the chances it will not infect you. The virus does not fly in air, or it does not take staircase to move from one floor to another, or attack from one person to another. We ourselves will pick this virus from outside to inside our home, from some objects around us to our body. If you continue to maintain hand hygiene, you can still avoid getting infected. Then cough and sneezing etiquettes. I see many people, when they sneeze, they will take out their mask. It's very funny to see that. The masks are primarily to see that that droplets which come at the time of sneezing or coughing should not come out. It remains inside your mask. In fact, you should put your hand or your arm above your mask so that it remains very tight when you sneeze or when you cough. I saw many people on streets, when they sneeze, they take out just to see that their mask is not soaked with their saliva, so that or some nasal secretions. So that is not the intent. The intent is to get everything inside your mask, not allowed to come out. Then 4th is mask. I think enough I said, and my colleagues are going to say more about mask. Not touching, MEN, man. I think this is a good acronym Rajan introduced this. So MEN stands for mouth, eye, and nose. So no matter if your hands are, even if you are in hand and apparently they look clean, don't touch your mouth, ear, and nose without hand washing. And the last point is report if you are unwell. My commandment number 9 is do not panic, exercise caution, and be prepared. The purpose of this very seminar is, or webinar is, to prepare everyone, to prepare each one of you, to make you feel that you don't panic. You exercise caution as much as possible. So that's important. There are instances where people, they excluded such people whose test came positive. They stopped entry of doctors, health professionals in their localities. They stopped airlines people to come back and meet their family. And many such instances that led to stigma and discrimination. So we have to see that our precautions, or this, sometimes I will say, the overprotectiveness should not lead to stigma and discrimination. We all are part of one society. We need to see that we all are safe, secure. At the same time, our relations, they are cordial, they are friendly to each other, and we should help others as much as possible. And that's my last point. We can be safe only if our community is safe. Everyone is in it together. Everyone has to follow the new normal of living. That's very important. With this so-called unlock 1.0, we should not relax to the extent that we defy all norms what we learned over last 3 months. So that's very important. We should continue to observe those behaviors which we learn, and believe me or not, this is going to be a new norm. In times to come, we are going to practice some new behaviors which we adopted as an emergency in last 2 to 3 months time, but in future they will become so normal. The mask which all of us are wearing now, and we used to laugh over Japanese, because in Japanese and Korean culture, wearing mask is something very normal. So we used to laugh over them. But now I am seeing that this wearing mask is going to become a norm even for a developing country like us. So with this, I stop here. These 10 commandments were primarily to tell that this is something which we all should understand, which we all should follow. And then my fellow colleagues from Public Health Foundation of India and UNICEF, they are there to respond to your questions which you submitted. So I wish you good luck, and I hope that our society will remain safe to all the residents, and we have a beautiful cordial relationship between our neighbors and friends. Thank you. Over to you, Hemant.
Thank you, Dr. Sanjeev, for the wonderful presentation. I would say very comprehensive presentation, and Dr. Sanjeev has explained the general things about COVID-19. I really appreciate all participants and those who have very interesting questions. We have received around 100 questions for this webinar, and considering time constraint, we will not go on these questions one by one basis. But what I have done, I have compiled these 100 questions under several sub themes, and my colleagues, panel member will resolve or will clarify things under those sub themes. So shall I proceed with question?
Yes.
Yeah. So we have panel member like Dr. Samiksha. She is an additional professor at Indian Institute of Public Health. Dr. Rajan, additional professor at Indian Institute of Public Health. And Dr. Shri Krishna, consultant at UNICEF. So my first question, as Dr. Sanjeev has mentioned general things, general awareness measures about COVID-19. So I would like to ask question, or I would rather say we have received several questions related to vulnerable groups for COVID-19, children less than 10 years and adults more than adults 16 years and above. So I have clubbed this questionnaire under one theme, and I would like to ask Dr. Samiksha these questions. So my first question is, or the participant of this webinar would like to know how to increase the immunity of kids at home. What kind of masks are to be used on a regular basis for adults as well as kids less than 3 years of age? Is it safe for the kids to play out? Dr.
Okay.
Samiksha, over to you.
Right. Thank you. Thank you everyone for having me here. I'll try my best to answer these questions, although the science still has some gaps in the understanding. But with whatever science and information we have, so the first question is that how to increase the immunity. So COVID-19 disease as such is also a flu. It's kind of a flu, and the normal things which we have been doing in general to increase the immunity of children remains almost the same. Things like proper nutrition, discipline in their day-to-day life, exercise, proper sleep, hydration, those basic concepts of a healthy child remain there. Apart from that, because if you are seeing that it is a flu season, so in general, in flu season, we tend to take hot milk or something which is warm and soothing to the throat, not hot as in which can burn the child's mouth or will not be comfortable. Generally, just a little bit of warm water or lemon water. Ayush department gives this things like lemon, ginger, tulsi. Concoction of these things can be a healthy concoction, but it's very difficult to give this to children. So what my advice would be, even if you just give them healthy diet, which you have been giving them, that would be suffice. Main thing would be protecting them from this infection. So far, the good news is that the children, although if they're getting infection, most of them may not have any symptoms. Or if they have any symptoms, they may just have mild symptoms who would just pass by as normal flu. And many of the parents may not even observe. Very few children may all seem to have a mild to moderate disease where they would need any kind of a medication. So for all the parents, that's a relief. But it's flu, it affects children. You can't ignore the fact that it can be 1 in 100 child who may get a severe disease, and then to run around taking the child to hospitals in this scenario of pandemic is not a good decision or good scenario anybody would want to get into. So protecting our children as everyone else, like Dr. Sanjeev said, everyone is vulnerable. They may not be getting severe disease, but 1 in 1,000 is still a number we should be protecting against. So how can we protect them? So the specific questions have been around mask. Yes, your children can also wear a mask, and for them a simple cotton mask, you can create or make a mask of your own at home. And while at home, children don't need to wear masks, because that's the environment everybody is living in. If they're going out, if the family as a whole is going out, advisable is that the pregnant women, the children less than 10 years, and the elderly above 60 years, and those with comorbidities should not go out of the house. So as long as they're at home with no sick person in the house, they don't have to wear masks. But if you may have to step out, and if you may have to take your child out, then a simple cotton kind of a mask which may fit to their size would be suffice for them. In case there is any sick person in your house or a person who has had high risk contact and is living in an isolated area, as long as you can ensure that the COVID positive case or a COVID suspect case who is at home isolation stays in the confines of that single room which is assigned for him, so that child, if is in the other part of the house, so the child does not have to wear a mask. The responsibility comes on the adults to ensure that they are far away from these children, from the children in the house, or keep the children away from such people. So in that case, you don't have to worry about the child to be wearing mask even with at home. But if certain scenarios are such you cannot maintain the distance with a sick or a quarantine person in the house, then try if your children can wear masks. But these are the scenarios what I can think of where the question of child wearing a mask may come onto. There was another question around it, if the children can spread the infection. Children can spread the infection, but what is happening in children as per science is that most of them are remaining asymptomatic or with mild disease, and their phase of infectivity is seemingly small. So there's no strong evidence in favor of it that they're spreading infection. At the same time, there is no strong evidence that they are not spreading the infection. So it's good that in this scenario where we are not very sure, it will be a good practice that we still take precautions and not let our kids also go out as much to play, or if they come back home, they follow all the precautions as the adults do, of immediately hand washing, face washing, if possible going to the bath immediately after coming back from home. I see another question here around kids again. I'll finish all the kids questions in one go. Was that, can we allow our kids to go and play in the fields together? I would say that we are opening up in the lockdown and we are not very sure how it is going to behave. If there are any sports which are leading to any close contact and coming in close contact with each other, I would still restrain that kind of sports activities. However, if there are certain activities which you can take your kids out for walks or runs where you maintain social distance as well as wear the mask, those kind of physical activities and sports activities shall be allowed till we understand how the epidemic is behaving further. So that would be my suggestions for the children. If any other specific question, you can pose that to me. Thank you, Hemant.
Thank you, Dr. Samiksha. I would like to extend the same question by asking one more question related to vulnerable groups. So participants have asked very specific question related to people age 60 and above. So question is, how dangerous is it for people above 60 years to step out to grocery store? Is traveling by taxi or plane not recommended for senior citizen with comorbidity? And another very similar question, if person coming to a house for taking blood for any test, what are the chances of COVID-19 spread to family members, especially senior citizens with comorbidities?
Right, thank you. See, senior citizens have equal chance of getting infection as anyone else. But the problem here is the severity of the disease which they get. And it becomes difficult. You have seen this evidence. All of you are well connected and go through the media and news. And it is well established that the mortality and the severity of the disease is very high amongst people who are 70 years and above, and people who have certain underlying chronic diseases. So the very reason why we are telling them not to step out of home is to even get away with any opportunity of infection as well. As far as possible, they should not step out of their homes unless there is absolutely an emergency. Even if they're old people who are living by themselves, I would, because RWA presidents are here, the whole community is here, it should be the responsibility of the association presidents or the volunteers or the neighbors to ensure that all the supplies are made to reach to their doorstep rather than having the elderly walking out for even basic needs. So they definitely should not step out. The question, other question is that unless they should not step out unless there is a other medical emergency where they have to go and see a doctor. A lot of things can be maintained at teleconsultation level also. Diabetics, the diabetics can continue to have their teleconsultation with the doctors and continue their medicine. They have to ensure they continue their medicines. Anyone with the history of hypertension or history of stroke, whatever medication they have been taking, that should continue. That is also an important message. So not just the grocery and all, the medical supplies should also reach to these people. And we can, if they do not have numbers of their regular doctors for teleconsultation, I guess as an association, we can think of taking some doctors on board for periodic teleconsultation for our residents and avoid any kind of movement for these people to any clinic. Yeah. So other question was, if somebody comes home for sample collection, especially from the elderly people. So if the person has come to take sample for anyone else in the family, at that moment of time, you can ensure that the elderly is sitting in some other room, does not get exposure to the person who has come from outside. But if the person has come to take sample from the elderly themselves, see, mostly these people who are coming for sample collection are trained for infection control practices, mostly. And if they are being called from a reputed lab, you can trust them. But having said that, you can take certain precautions at your level also. Like when the person comes in, ensure that he does proper hand sanitization before touching any of the surfaces in your house. You ensure that the person is wearing mask all the time. You ensure that the elderly person is also wearing a mask if it is not a nasal swab or a oropharyngeal swab which is being taken for COVID. If it is blood sample and all, the elderly should also be wearing a mask. And when the sample is being collected, ensure that the person who is collecting the sample stands on the side of the person. You don't come on face to face. No, face to face, you come close, you have more chances of transmitting the aerosols around. But if you are not coughing, that person is not coughing, both of you are wearing masks, and the person comes from the side, and the elderly can just turn the face on the other side while the sample is being collected from hand or somewhere else. These are small tips by which you can reduce the chances of getting infection as much as possible. If it is to collect a nasopharyngeal swab or an oropharyngeal swab for COVID testing, so I'm sure that testing is happening because you are being suspected for COVID. In that case, you don't have to worry too much of you getting an infection. And then it is more about worrying that the person who has come to take the swab from your mouth getting an infection. So at that time also, the person can take precautions. They are trained how to take precautions. Once the sample has been taken and the person collects all his material and goes out, the family members can ensure that the elderly or whosoever sample has been taken washes his face, arms, everything with proper soap and water, right? So that if at all there has been any contact, that can be taken care of. And wherever the material for sample collection was kept or the surfaces this boy would have touched when he came in, you can disinfect all those surfaces, doorknobs, immediately after the person has left. See, the important point here to note is that the transmissibility of this infection is not that you just come in contact with a COVID positive case and you will get infection. There is a role to play on viral load and duration in which you have been in close contact to that person. 5-10 minutes with proper precautions has very low transmissibility rate. So do understand, with proper precautions is important. You can't ignore that. So if the person is not actively coughing, you are not actively coughing, so you definitely have low viral load. You are not spreading that high viral load aerosols. So that is one good sign. And then you are wearing mask, reduces the transmissibility even lower. And then you are coming in contact for a shorter period of time, taking all the precautions of hand hygiene, further reduces your chances of getting infection. So don't panic. If it is really necessary to get tests done, get them done, as they are essential for the elderly. I hope I've given in detail the understanding of the process.
Thank you, Dr. Samiksha, for explaining the implications of COVID-19 for vulnerable groups like children as well as elderly population. We got so many questions from participants for Dr. Rajan, and these questions are related to getting out of the house in the community and during walking and jogging. So during unlock 1.0, several people are coming out into the society, and it has been observed that in supermarkets or other grocery shops, people tend to come near less than recommended social distance while picking items, and this also happens during walking in communities. So, is this safe? What should be done to avoid COVID-19 infection in such situation? And another very related question one participant has asked: each time we go out for walk, I am in a dilemma whether going out is giving me a health benefit or staying at home is safer option. Uh, on very similar line, there is one more question. In the community, people are not permitted to access parks and play areas. However, the pathways are open for walking and running. Is there any need to lock up parks and play areas if people exercise enough caution, wearing masks and practicing social distances and do not congregate? So, Dr. Rajan, what do you think?
Yeah, thank you, Hemant. And this is actually, some of it is more of a continuation of what Samiksha has already covered. Um, but let me just start with the first one about going to grocery stores, supermarkets, um, uh, because in supermarkets other buyers tend to come near. What should we do? So Samiksha and Sanjeev have already emphasized that it is both the quantum of the contact, the duration of the contact, and the viral load. And if we are wearing mask, if we are maintaining proper social distance or physical distance, um, then the risk of transmissibility is less, but it is still there. So caution has to be exercised. If you're going out to an unknown environment, a new environment, always practice hand hygiene. Do not touch your mouth, ear, nose. Even if you're wearing gloves, gloves can give you a false sense of security that you're wearing gloves, so you're fine, and subconsciously you might touch your mouth, ear, nose. All these things are important. Going out is essential sometimes, but try to avoid them. Try to use online services wherever possible. But if you have to go out, then take necessary precautions. Coming back to the dilemma, and this is a very good question. Should I go out for walk? Is my risk more if I go out for walk, or is it more if I stay at home and don't do much exercise? You can always do some exercise at home, but yes, going out in open air makes us feel relaxed, makes us feel nice. My advice is, one, don't go to crowded places. Go out for a walk, go on your own, use mask when you are moving around. Go in a known surrounding, don't go out in an unknown surrounding. And it is important to have some amount of exercise. Because this is a long term, this is not a short term measure. We will be into it for 6, 8 months, or even a year and longer. So minimum is around 6 to 8 months, and it could go on for a year and 2 years. So nobody knows with certainty how long this is going to last. So we need to develop systems where whatever is essential to remain healthy, which is essential for living, we need to practice those, but with adequate caution. I think in this, it is also linked to the use of lift. What are your risk of getting infected in a lift, and especially if somebody is there without a mask? If there is somebody without a mask in the lift, either your society should be strict about it, and they should ask, you should move out and report this to the society, or um, if you are in a public place, just move out of the lift. You see somebody walking in without a mask, you are inside, move out. If you are walking into a lift and you see somebody without a mask, wait, let him go. But we have to treat as though, as a precaution, that everybody whom we don't know around us is infected. There are a lot of asymptomatic infections. So that becomes very important. Uh, Caution is the main mantra. Panic, no. Caution, yes. Okay. So that is important. And that's therefore lift, just by going into a lift, your risk of infection is not very high. You practice hand sanitization, you punch a button, you carry a sanitizer with you, use that sanitizer, hand rub, alcohol hand rub, and you're fine with that. Uh, once you and once you are in a lift, you are using a mask, so you are safe. So as long as you're not touching everywhere in the lift, lift is not going to send virus and throw virus on you. So that way you are safe. But if there is somebody without a mask, better avoid it. If it is possible, if there is a system in your place, report it, so that this sort of habit is discouraged, behavior is discouraged. And I think that is the way to go forward. Third is about the community areas. I mean, walk pathways are opened, but play areas are not opened. And what should be done about it? Should they be permitted? Should children be permitted to play? I think Samiksha covered part of it. My take on this is that if we allow adults to use a play area and say that they will take proper precautions, then it becomes very difficult to tell children, you don't play. Okay. So if there is something that can, if you have a private bungalow of your own, and you have a lawn tennis court and a badminton court of your own, you can go ahead and play, as long as you sanitize. And but in a community it becomes difficult, because there are a lot of other users who will then want to use, and everybody might not be mature enough like adults to practice this behavior. And then it becomes a risk to the whole community. Okay. So that is where the concept, closed environment like gym and all, will be locked down. But even open places like lawn tennis court, badminton court, basketball court, um, cricket pitch, all these, at the moment, let us keep them down. Let us see how lockdown, let us see how the cases evolve over a period, because we are in uh, unlock 1, we will be entering unlock 2. Let us watch. And these are, I don't think these are absolutely essential activities at the moment. Yes, physical activity is essential, so people can go around walking, running, cycling, and you have access to those. Let's wait for all these activities. um, Anything, Hemant, anything I missed out on?
Dr. Rajan, you have covered all the points related to coming out of house into the community and going into grocery store. Uh, on the same theme, that is a transmission of infection from other people, some participants have expressed their concern related to transmission of infection from maids as well as housekeeping staff. So the participant want to know, how do we ensure maids and workers who may be coming from unsafe zones and who do not have enough facilities and space in their small homes where many people may be residing remain uninfected and spread of infection to community people? Also, whether only use of mask as well as washing hands before start working are sufficient to prevent the transmission of infection from asymptomatic maids to house owners.
So let me start with this. I mean, any additional exposure in an household, so a maid coming or a cook coming or any domestic help coming or even housekeeping staff coming into your societies, is an additional risk. Okay. But you need to measure whether, how essential is this additional risk, and what measures can you take to mitigate this risk. Okay. So it is an additional risk. Is it essential? First, if it is essential, then what measures can I take to mitigate this risk? And to some people, it might not be essential. If I am just, if we are just husband and wife, we could probably manage, cook our food and manage our thing at home. But if you have young children, you have elderlies at home, then there might be need for some support. And in that condition, so each household's need might differ. So best thing to do is have systems in place so that when these people come in, we have systems in place to screen, to educate, to sanitize, and then each household can take their own specific precaution. So that is how you can go about. But yes, anybody entering a society is an additional risk, whether it is your delivery boy, whether it is, but you have to then take a call on what measures and how you can mitigate this risk. It is a long period of lockdown, so we have to be prepared for those measures. Um, in terms of going out to workplace and um, uh, because most of the offices might start opening gradually. My office has been open for a month now. I've been going to office regularly. Um, so in that situation, yes, you are wearing mask, you are using gloves, or you are using hand sanitizer. Um, uh, what else can be done? So what needs to be done, and this applies to the Resident Welfare Association also, we need to have a system at the gate to screen. The first level of screening should happen at the gate. And having thermal screening, even though its efficacy 100% in terms of detecting sick people is not there, but it is something better than nothing. Having hand hygiene measures at the gate, having hand hygiene measures in the building, having hand hygiene measures near the lift, all these are important. Individuals to carry hand hygiene, hand rubs, those are important. So these measures should be taken. Then when the house help or the domestic helps come to your house, then the resident should take responsibility of asking the domestic help about their condition, using a thermal scanner to check temperature, asking them about their family. Is there any problem in the family? Anybody sick in the family? All these things the resident will have to take. If you find answers to any of these questions, yes, uh, educate your maid, send her back. You can sanitize all the surfaces that she was around or she came in contact with, and you can still remain safe. But those households which need these helps, they will have to take these precautions. Those households which are fine without them can take a decision not to call in domestic help.
Thank
Hemant?
you, thank you, Dr. Rajan, for explaining the probability of disease transmission from house help or other community members. I have next question I have for Dr. Shri Krishna, and several participants have asked questions related to COVID-19 testing, COVID-19 management, COVID-19 treatment. What is the protocol if somebody gets positive? What is the protocol for isolation? What is the protocol for quarantine? Let me start with first question. So which tests are currently used to diagnose COVID-19? Where does one should go for initial COVID-19 test? How long does it take for the result to come? If tested positive, what are the next steps? How to decide if one should go to government hospital or a private hospital once tested positive? What are the cost of hospitalization? Who pays that cost? Does insurance pay? Does government pay? Or does individual have to pay? What are your thoughts on this, Dr. Sri Krishna?
Good evening, everyone. At the outset, let me thank Dr. Sanjeev, Rajan, and the IIPHH team for asking me to be part of this. I'll take about 10 to 12 minutes, and I have a few slides to share as well. And I have the toughest questions, and I'll try to do justice to whatever I have been asked to present. All right, so I hope you can see the slides here. many of us at this particular stage, about 2 months after the lockdown has started, are in a peculiar situation. Much of our worry is about ourselves and our kids. We roughly know about the disease. We know what needs to be done. The concern is about the health. And we've been hearing that everyone is bound to get it at some stage or the other. So what do we do once we're getting sick? To begin with, let's all first go down to the government's website. This is the Telangana government's website. Not sure if all of us have actually gone through the webpage. Please browse through the webpage. It's got very good information which is relevant for all of us. Why did I go through this as a specific slide? To take you through to this. These are the control numbers for COVID-19. Any query that you have, please call these numbers. I wouldn't say they're most responsive, but at least if you try it once and 5 times, you will definitely find a person who will answer the call and give you whatever information they can at their end. So you have different segments and you have helpline numbers. Please use these helpline numbers. You also have the contact numbers of the RMOs of the TVEP hospital. TVEP is Telangana Vaidya Vidhan Parishad Hospitals. And this is again available on the web page. And the one which we need is this. Area Hospital Kondapur is the one which is closest to us. Dr. Ramakrishna is a very nice person. Feel free to ask him. Ask him whatever queries you have related to testing, treatment. If you get fever, if you feel like you're getting fever, all your concerns which are health related, please feel free to ask them. Unless you hear it from a doctor, it's our nature that we won't be satisfied. So please feel free to approach the helplines, to approach Dr. Ramakrishna, who's an area hospital. This is all on the web page, and it's that person's job, just like our job today to inform all this to you. His job is to share his knowledge with you. Now coming to the testing, anytime if you have a query on what exactly is the criteria for COVID testing for me or for others, please go through the ICMR web page. And on the ICMR web page, you have very clear criteria on when what test needs to be done. And this is all very clear. And the current strategy is as on 18th of May. Take a minute to just read through these 9 sentences. All of them say symptomatic, 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 which means if you have ILI, which is influenza-like illness, you will be tested. This is the current guidelines from ICMR, which the state is following. Some of the states, because the state can choose to do more on the health front, some of them are testing as an additional criteria, but Telangana state, for all practical purposes, follows these 9 criteria very strictly and diligently. Of the 9 criteria, there's only 1 criteria which caters to those who don't have symptoms. You all know that 80% of the disease is mild or even asymptomatic or pre-symptomatic, so you don't have enough symptoms. But still, you're not getting tested because ICMR has these criteria. Even those who are asymptomatic, you need to have been a direct high-risk case contact. When I say case contact, it's with a confirmed case. So let's say in your community, you already have a confirmed case. You've come into contact and are high risk. Even then, they're going to test you between day 5 and day 10 of coming in contact. Otherwise, the testing criteria is if you are symptomatic. Symptomatic with travel, international travel, symptomatic with a contact of a laboratory confirmed case, symptomatic with severe acute respiratory infection, symptomatic enough to require hospitalization, etc. Now, let me take you through the categorization. This is from the Indian Medical Association headquarters document, and this is more like a guidance note for all specialties across the country. This has directly come from IMA 3 days back. And this is able to clear the myths and give some clarity to the physicians and the hospitals who are treating. So as per this categorization, there are 3 categories, A, B, and C. A is the one which we all know, the 80% of them which are mild. So they have mild sore throat, cough, rhinitis, diarrhea. B is the one where there is fever and or severe sore throat, cough, diarrhea, or a category A symptoms with either lung, heart, liver, kidney, neurological disease on long-term steroids, pregnancy, age more than 60 years, or even if you just have simple cardiac problem, cardiovascular disease with category A symptoms, then you become category B. Why did I put it up like category A and then category B? Because your hospitalization and your admission is highly dependent on categorization. Category A, which is what? The mild sore throat, mild cough, rhinitis, diarrheas, they do not require hospital admission. So even if you go down to a hospital and say, I have mild sore throat, I have cough, test me, they will not test you. You come into category A. The treatment as dictated and as recommended by IMA is you have home isolation. This is necessary to contain the virus transmission. So and you provide the patient with a mild COVID-19 with only symptomatic treatment. So what you get is antipyretics for control of temperature. Do not use anything other than paracetamol, no ibuprofen, no combiflam. Even if your temperature is high, viral fevers have temperatures up to 5 days. They come down by themselves. We'll see what to do next. But to begin with, kindly use only paracetamol. Telephonic follow-up will be arranged and you counsel them about the complications and when to come back. When do you come back? When you get into category B. Category B, based on the clinical assessment, you will be either admitted in the COVID isolation unit or if the need be and if you are stable, you may still be sent home. However, in the state of Telangana, there is no testing on an outpatient basis. All testing is for those who are admitted and staying in the hospital. Again, going back to these criteria. Now, let me take you through a couple of scenarios. What do you do on day 1 of fever? Let's assume, God forbid, you get fever. Please immediately have teleconsultation. Teleconsultation, many of the hospitals around, if you are at Aparna or at L&T, you have Care Hospital, you have Continental who have teleconsultation available. Please talk to the doctor. There is nothing better than a doctor reassuring you and telling you what the exact problem is. Please consult if you feel you have any temperature which is more than 100 degrees when you measure it. Okay, the doctor most probably may say this is isolated fever with no viral symptoms, probably COVID, probably not. We'll observe, wait for 2 days. So day 3 fever. Now what do? This time, any fever which is beyond 48 hours, ideally now visit a doctor because you need examination. The person has to examine your throat, look at the hepatomegaly, splenomegaly, examine the lymph nodes. Lot of examination may be necessary. And this is difficult on a teleconsultation. Therefore, the suggestion on day 3 of fever, visit a doctor. Most likely they may take initial blood samples. For example, CBP will show low WBC counts. CRP, LDH, serum ferritin, all of these may show some abnormality. This is recommended on day 3. Day 5 of fever, assuming that you have been put on azithromycin, still the temperature continues. Day 5, admit. In fact, on day 3 of fever, if the blood tests are showing any symptoms of viral infection, then you go back to that, recall those testing criteria. That is fever with influenza-like illness. So if these criteria are fulfilled, then the hospital themselves are going to send the blood sample for testing. Testing will be as per the hospital and the government policy. I'll tell you a little more about it later. If you're sick, please take rest, follow treatment protocol, don't panic. If you panic, the amount of oxidative reaction in your body increases. More oxidative radicals delay your improvement. There is nothing that you would be able to do once you already have fever. What you need is the correct guidance, and that is what we're trying to do here. Discharge policy is very clear. It is not as if you will go today, test is positive, you will just come back home. Very clearly, the discharge criteria is, even if you are mild or pre-symptomatic, discharge after 10 days of symptom onset and no fever for 3 days. I don't want to go into the rest of it, but please understand the majority of them, and once they get admitted, if the test is positive, then they would stay for at least 10 days after up to symptom onset. Moderate and then severe will be managed accordingly. Now, a couple of questions which I have had and I would like to respond to them. Which tests are currently used to diagnose COVID? Whenever there's a virus that enters your body, there are two components. One is the virus itself, and the second is the reaction of the body. The virus itself is the viral antigen. So the antigen can be detected by what is called as a PCR, polymerase chain reaction. It detects actually the DNA or the RNA of the virus. So the test is called PCR or RT-PCR. This detects the virus. The second type of test is where the body's reaction is detected by antibodies. There are two types of antibodies and they take some time to form. Even after you get infected, they stay on for a variable period of time, sometimes up to 1 month also. So the current strategy for testing is RT-PCR is the test which is done, which detects the viral antigen. Where does one go for initial testing? Step back 2 steps and then ask yourself whether this looks like an influenza-like illness. Otherwise, follow what the protocol or the suggestions. I would say this is clearly from experience and on a personal level. If you've got fever, consult immediately, teleconsultation. Day 3, that is when the testing, and leave the testing choice to the doctor. The hospitals are required to submit the case sheet along with ABG in some cases. That was the earlier requirement, and a detailed explanation why this particular person needs to be tested. Let us not debate into why a certain system is in place. I'm trying to tell you how it actually works. So in case this person is day 3 fever and fulfills those criteria for testing, then only the testing will be done. If the test comes back positive, you are already admitted by the time the test goes. So they continue your admission, discharge you as per the discharge criteria which I have indicated. How long does it take? Right now, it takes about 24 hours for the test to come back. The initial workup doesn't have to be only the antigen testing. CBP, CRP, ferritin, lot of others also give us some clinical clues whether this is virus or not. Under the virus, again, is this COVID or not? Now, if tested positive, next step, stay in the hospital. How to decide whether one needs to go to the government hospital? As of now, the government is indicating private hospitals to take admissions and keep the patient in their hospital. They are not encouraging private hospitals to refer everybody to Gandhi. It is not necessary that if you get positive test, you have to go and end up in Gandhi the way you feel. Continental is accepting. AIG is also accepting. There are a couple of hospitals, Apollo Hospital, Jubilee Hills is also accepting cases, but then they also have demarcated beds. For example, in Continental Hospital, out of 7 floors, the 3rd floor, half of it is demarcated only for COVID, and the remaining part of it is not demarcated for COVID, which means you have X number of beds, and if those X number of beds are filled up, there is nothing that Continental can do about it because it cares for both COVID as well as non-COVID. How does it work in the government sector? What government has is the liberty of identifying a hospital as COVID and non-COVID. So Gandhi Hospital, the entire hospital has only COVIDs now. Anybody else who is non-COVID and looks sick will be referred to the other hospitals which are close by. Like this, how many beds have been created? I would say close to around 5,000 beds as per the government of Telangana's reports, 5,000 beds that are available. The Telangana Institute of Medical Sciences, which is the nearest for our communities, is ready. What is necessary there is the human resource for the facility to run. So once that necessity is there, I am sure that you will have the people and also the resources there. Next, does the government pay? The government will pay if you're in the government hospital. All management is free of cost. In the private hospital, the government does not give any subsidy or payment. From what I have understood, in most of the cases, especially for insurance, there are clear clauses wherein based on your policy, they indicate whether consumables, non-consumables are part of the clauses or not, the policy clause or not. Much part of the expenditure in case of COVID comes down to the use of the PPE. As I said, it's a viral illness. The drugs are not very costly. It is a management which takes up a lot of effort and also money. So if the insurance covers your PPEs and all the consumables, yes, they might be part of the package. Else, I would presume half of the total cost of treatment has to be borne by the person, even if you have insurance. Again, it depends upon your insurance policy details. Are there different protocols for kids? Kids are equal to adults in terms of their risk, in terms of their need for prevention, in terms of their immunity, and also in terms of their management. Kindly don't assume the virus doesn't come to kids. Then the relaxation happens and kids actually get the virus. It is just that the ACE2 receptor, which is necessary for transportation of the virus inside, is not so well developed and doesn't detect the antigen so easily. That's the reason kids are slightly spared. But when it comes to care that you need to take, same care as you take for adults, same protocols even for treatment, same protocols for testing. If you see those 9 sentences, there is nothing which is specific on kids for that. If you have to travel, this is a big topic in itself. Unfortunately, states are given the liberty to have their own protocols for entry, exit, national, international as well. Currently, Telangana state has its own specific recommendation. If you go from Telangana to, let's say, Bangalore or Delhi or Mumbai, you need to follow that particular state's protocol for entry and quarantine, or whether they want you into isolation. Currently in Hyderabad, any person who is entering, as of now, you are not being taken to a hospital and kept. They are going to track your status. A health worker will come and definitely visit you over the next 1 week. In this 1 week, they might put you into a facility where you are at the closest place to your house, and these are called as the home isolation or the quarantine facilities. But these are very specific to each state and highly variable. It might even change by the time we finish this presentation. And will I be infected if I touch an infected person? Assume it is yes. If you tell yourself yes, then you will get into the habit of hand wash. Frankly speaking, the chance of you getting infected is dependent upon the viral load as well as your immunity. If your immunity is strong enough and the load is less, you might only have a pre-symptomatic or a very mild illness. If you visit a hospital, is it safe? Let me now take a minute and explain to you. There are hospitals which treat COVID as well as non-COVID. They are mandated to have separate entry exit and a completely different team which manages COVID and non-COVIDs. They don't interchange. The staff doesn't mix up. Even the consumables, everything is on a different level. The big hospitals which are around you follow all this. So it is definitely safe for you to visit. If there is an operation, even then it is safe. And these hospitals, at least the ones which we are talking about close to our community, are definitely safe. Refer back to the slide where day 1 of fever have teleconsultation, day 3 of fever go, and they will guide you to the fever clinic. Do not panic, and they have all the processes in place, and there's a QI system and also an internal team that looks at adherence of these protocols. Now, if we visit them, yes, it is safe, as I said. Then will the corona infect the person who is undergoing checkup? If you wear a mask, if you follow hand wash very strictly, the chance of you getting the infection is very less. The virus doesn't come to you. You have to go touch the virus, take it to your mouth and your nose. You have to infect yourself with the virus. Virus will not jump and come to you. So as long as you're able to take care, only stepping out when necessary and taking all the precautions, you're visiting a hospital because you're sick, and when you're sick, you're taking all the precautions, the chance of you getting infected from another sick person in the hospital because of COVID is much, much lesser. Do not neglect treatment. Do not stop yourself from going out and getting tested or following the protocols out of fear. Now, what is the most dangerous form of spread? It is the contact spread, and the importance of hand wash has already been established. The coronavirus has spikes. These spikes are made of glycoprotein, and they are held together like my hairband. It's held together by a lipid membrane. This lipid membrane dissolves with soap. It just disintegrates the virus. Little soap. That's how delicate it is. So, and hand washing is a habit. It doesn't come automatically. You need to practice it. So make sure you're washing your hands as a matter of habit, whether at home or outside. Try to avoid contact with anything which you feel is unnecessary. Don't panic. Follow the protocols whichever are in place, and I'm sure we should be safe. Now, as of now, there is no definitive treatment. Yes, still the recovery rate is getting better. What could be the possible reasons? Multifactorial, difficult for us to say this is a specific reason. And has the virus weakened with time? No. And don't assume that it's getting better or that your immunity is strong enough. Each one of us is equally susceptible. Role of BCG vaccination, it's all assumptions, and we don't have an RCT that can really tell you it works or doesn't work. So as of now, it's not part of protocol of management either by IMA or by Government of India. Lot of talk on Ayurvedic and homeopathy. You already heard it from Samiksha. That's all from my end.
Thank you, Dr. Shri Krishna, for the excellent presentation
Shri
and
Krishna, yeah, just
excellent explanation.
yeah.
Yes, Rajan.
Hemant and Shri Krishna, if I can just add regarding the insurance. The insurance, if you have a coverage for hospitalization under your insurance plan, then IRDA, the Insurance Regulatory Authority, has issued instruction to all the insurance plans to cover COVID hospitalization under that. And COVID hospitalization will include, once you are hospitalized, 30 days prior to hospitalization, whatever investigations are required, and 30 days after hospitalization, whatever expenses are incurred, including ambulance and other things, would be covered if you have your regular healthcare plan which covers hospitalization. There will be some co-pays and other things which are part of your regular hospitalization plan. But these instructions have come from IRDA, and if somebody is not following, you can always complain to IRDA.
I'll just take, Hemant, I'll just take 1 minute to answer Vivek's very nice question. And this is something I've learned with experience. How do you engage the kids and ensure their wellness and at home? By being a part of their activity and them being a part of your activity. Make sure you all get up at the same time, assuming you're all going to work and going to schools. If you have been tuned to a prayer and then starting your work at 9 o'clock, so be it. Please continue the same. If have your breakfast, lunch, dinner, everything on time. Earlier, probably lack of time, you did it at different times. Now you can do it together, prepare the food together, have the food together, use that time very effectively. Don't try to do any binge watching with the children. If they had earlier a specific TV time at, let's say, 4 in the evening, follow the same. You can do lot of physical activity with the child at home. And the best way to stay fit is to do the physical activity with them. Do the ab crunches, do the squats, do the push-ups, do the cult sessions, all of them with the kids. And in due course of time, they will actually push you and they will get into a routine. The best way to engage kids is be a part of their activity and make them a part of your activity. Right from sweeping the house till playing with them, and also sleeping on time along with them. That should help. That's all from my end, Hemant. Any questions specific to me, I'll be happy to take them.
I think Dr. Shri Krishna, you have answered and explained each and every question whichever were assigned to you. Thank you so much. We got a few questions, few very specific questions for Dr. Samiksha. All these questions are related to presence of virus on different surfaces like fruits, metals, and everything. So let me just read out the question for Dr. Samiksha. Specific questions are: does newspaper carries a risk of COVID-19 spread? How safe is it to visit barber shops, beauty parlors? Is it a risk to order food from outside in these days? Is it safe to eat out? Are open marketplaces safer than closed markets? Is playing sport while maintaining hygiene is okay? Is wearing mask during fast walking or running recommended? So Dr. Samiksha, could you please throw some light on these specific questions? Hello?
There are very different scenarios, and thank you for asking such questions, because these are the day-to-day things which we deal with. And there are a lot of questions there. So if I miss any of them, just do remind me, Hemant. The first was about the newspapers. The latest report from CDC says is that the risk of transmission through contact surfaces is lesser than what we earlier thought. Having said that, there are viruses, yes, definitely there. Paper, cardboards are amongst the least, amongst the material which sustain the virus in the least, for the least period of time. So for the paper, it is around 3 to 4 hours, and cardboards another 4-5 hours. So newspaper may carry it, yes. We do want to trust our vendors that they are taking all the precautions. But what you can follow is that if you have a newspaper, after it has been distributed to your home, let it stay there for 2-3 hours before you take it and start reading it. It would be safer after 2-3 hours. And once you have read your newspaper, again, you can wash your hands if you are so worried about the risk on the newspaper. Otherwise, papers and cardboards are something that You may have heard some advisories that if you come from outside and if you want to keep your phone, your keys, or other things which you have brought from outside, so it's best to keep them in the newspaper or cardboard box, because that material will not sustain the infection as much. Plastics tend to have it for a few hours, up to 9 hours a day. Metal materials, they can sustain it up to 3 days. So that's why the common touch areas we talk about, that they has to be frequently cleaned. So that's broadly. And this doesn't really help much, to be honest, because you never know in your lift the suspect case touched 3 days back or 2 days back or just 2 hours back. The bottom line comes down to is that you have to frequently do the sanitization activities for the common areas and wash your hands. So you don't have to really freak out about the material surfaces. But I do get it where the question is coming from, especially when you are ordering some stuff from online shopping or food from outside. And that's one of the questions which Hemant posed also. As long as you can deal with this packaging nicely, whenever you get a package, you open it in a cornered area and throw the packaging away, and then disinfect that surface where you have opened that packaging and wash your hands, you can deal it with fine. Then the question here somebody asked was, what about the stuff inside the packaging of that courier? If it is grocery or if it is something which is washable, the best thing is just wash it with running water. That itself is suffice, and let it dry. If it is something which is not washable, it is some equipment, if you can sanitize it, and your hands, let it dry, you can use it. If it is something which cannot be washed nor can be sanitized, better to leave it on the side for some time if it is not of emergent requirement, and then use it after 3 days. That is the last resort. If it is food, how do you deal with food? The external packaging has to be dealt the same way. Ensure that when you take any package from any courier guy, you clean the external packaging, or you take off the external packaging and throw it away. While you are handling it, ensure your hands are sanitized and you handle it properly. Cooked food, the inside cooked food which you're talking about, is not known to show to be a risk of transmission of virus. You can very well consume the food which you have ordered from outside. At least it will not be as much a risk for COVID. It may be a risk for typhoid or E. coli or other diseases, but cooked food would be less of a risk for COVID virus infection spread. It's just the dealing of the packaging which you have to be carefully dealing with. Let me see what the other questions were, because there were a few. Can you remind me?
Yeah, question related to playing sport while maintaining hygiene and
right.
Wearing of mask during fast walking and running.
Okay, great. Exercise. Right. For that, see, any kind of contact sport right now is not encouraged. Any kind of a sport which can help you maintain physical distancing can be done. Requires a lot of discipline. I guess even adults fail to maintain that discipline. Expecting that from children will be difficult. So I don't have a specific answer to this. It is all about how much we can take the responsibility and follow it through the discipline. So the physical distancing would be important. About wearing masks, when you are playing, when you are in active sports activity where you need aerobic zone and you need a lot of air and oxygen. See, as long as you're walking, doing general activities, masks seem fine. But if you get into playing football, cricket, going for jogs and runs, then it is not as advisable to wear your mask. Then it is advisable to maintain distance wherever you're going. Go for a run at a time when there are not many people around the space. You can run, but maintaining the physical distance. That would be recommended. So my suggestion for now is that even if you talk about taking precautions of hand sanitization or wearing masks, contact sports should be avoided right now. Then there are questions around barber shops, beauty parlors, and open spaces or closed spaces. So First, I'll take about the barber shops and beauty parlors. Here, the risk of infection is both through your aerosol droplet and the contact. You have to be confident of the space you are going to. The same principles of those 6 points play here as well. When you enter into a shop, you do your hand hygiene so that you don't take any infection from outside to inside. You are wearing your mask. The staff there is wearing mask. The staff there is sanitizing their hands frequently. Or the tools they are using, they are not reusing them. The towels are not reusable towels, because that's how the contact will spread. And barber shops become even difficult if you go for shaving and cutting off your hair. The barber has to come close to you. It's definitely a risk. As far as you can avoid, that would be better. If you cannot avoid, so the way it should be done is the person should not come in direct face to face to you. If we can do your shaving or cutting of hair from the side or the back with the mask on, and at some places they also do a face shield on and gloves on. But this can look fancy but may not be very safe unless you are sure that the barber or person who is attending to you does not have a disease. One is that important. Two, if they can be asymptomatic. If they're asymptomatic and using face shield and gloves, you have to ensure that those face shield and gloves are also sanitized before they come close to you and use it. So don't get fooled by the protection they're using. That protection should also be sanitized before they use. So if you can take care of these precautions, ensure that these activities are done in front of you, and then allow any kind of treatment on your face, then, but if it is not required, it is unnecessary. I would avoid doing it. I personally would avoid doing it, because you are allowing someone to touch your face with clean or unclean hands. So be careful if you go about it. Shops closed and open shops. See, the virus is such that most of the time the viral load will stay up to 3 feet, then up to 6 feet. And very small aerosols may stay in the environment for a longer period of time, which is seen by science. But that viral load is less. If you stay in that closed environment for a very long time without any mask, then you are at risk of infection, right? So if that open space is if you can have it as a ventilated space, that milder aerosols may just fly off. Then the risk is more about coming in close vicinity or touching the surfaces where the droplets would have fallen. It's recommended that as far as you can manage without AC and have your windows and doors open, that would be good. So if you apply that philosophy of it, open spaces are open market shops are better than the closed shops, but closed shops are fine as long as you keep your masks on and ensure that you do not touch the common spots too much. And if you are touching the common spots or clothes or whatever material, ensure that you keep sanitizing your hands in the meanwhile, right? I guess I've covered most of the questions. There's one more question about how to deal with the grocery. As I said, grocery, what you bring, vegetables, what you bring, thoroughly washing your vegetables. Right? You don't have to go finicky and washing them with soap and water and detergent. Just thoroughly washing your vegetables and letting them dry is enough for dealing with reducing the transmission. If you're getting something which is packaged in the wheat or any dal or anything which is packaged, and you can wash it from outside, even thorough washing with water is enough to deal with the packaging. Let it dry. Letting it dry is also important. And then you can put it into your containers wherever you want to put it. The risk through vegetables or these grocery packages, it is not that much high if you just take simple precaution of washing, and after that letting it dry and sanitizing your hands. That's all basically you require to do about it.
Thank you, Dr. Samiksha. I just got 2 more questions for you. These questions are very general. One question related to one of the few researchers at the University of California found out that virus can be spread across 20 feet, what we usually call as 1 meter or 2 meter, but the scientists at the University of California had said that virus can be spread over the distance of 20 feet. So in such scenario, what are your thoughts on social distancing? And second thing, whatever precautions, whatever general awareness measures we are recommended to follow during COVID-19, how long it will go on?
Okay. How long it will go on? I guess that will become your lifestyle for the whole life, the rest of your life. That is my opinion about it. At least the hygiene part of it, and that would be a good thing, because it is something we also deal with flu every year. Our elderly deals with flu every year. If we inculcate some positive habits, that's good for our community. But specific, the contact related or not coming too close to each other, I think 1 year is something you should be looking at, because in some way or the other, the virus can come and go till we are very confident of that. If we have any treatment in place or vaccine in place, we have to think long term. It is not for another month or so. Even if we open up completely, there is lockdown, opening up of lockdown 5.0 or 6.0, whatever. Even then, the responsibility is on individuals right now. This pandemic now is more about how the community deals the pandemic rather than how the politicians deal the pandemic. So just think of it as long term. And the specific question which has been raised is that the studies said that virus can be spread even up to 20 feet of distance. I'm not denying that. And when I was answering the previous questions, I was mentioning it. See, it is a role to play of the viral load. So if when I talk, when I cough, I produce some droplets, big size droplets, small size droplets, and very small size droplets. Each one of them may have some virus in them. The big size will just drop at 3 feet, some by 6 feet. Another very small droplets may just float, aerosols may just float in the air, but those ones, so the one within the 3 feet have higher viral load. The transmissibility, when we talk about when you have higher chances of getting infection, depends on two things. How much is the viral load, plus for how long have you been in that high viral load environment. That's why for general areas of social distancing, we say that 3 feet is something you should maintain. That's minimum, because the viral load in that distance is high if the person is talking aloud or coughing. 6 feet, the viral load goes further down, moderate level. And beyond 6 feet, it is very mild. So if you are wearing mask, if you are not touching common surfaces as much, if you're maintaining that distance in common places, open area, that mild aerosols may just even spread out. So your risk of infection at 20 feet is very, very low. And that very, very low risk is for so many other diseases. So you don't have to worry about it. You have to ensure minimum 3 feet, 6 feet, well and good, and mask. Right? If you take care of that, you just don't have to panic. There's nothing to worry too much about it.
Thank you, Dr. Samiksha. And finally, we got few specific questions for Dr. Rajan. Dr. Rajan, let me just read out these questions for you. And these are very general questions. Has community transfer of COVID-19 cases taken place in India? And if yes, then how does this unlock 1.0 helps in controlling this? Second question which I got, what happened to an asymptomatic person? How to identify asymptomatic person? Will they suffer from COVID-19 eventually? And one last question is, some participant had mentioned that the Gachibowli Stadium was being revamped into a COVID-19 facility. Is that true, or is that ready? So what do you think?
Yes, Hemant. Thank you for those. Those are general questions, but I think important ones. we have been hearing about this community transmission, and let me just first explain what community transmission means. So when you have cases coming and you cannot trace from where they got infection, then you start suspecting community transmission. If these cases become high, the numbers become high and they come from different locations. If they are coming from one location, then you say that cluster has community transmission. But if they start coming from different parts of the city, then you say the city has community transmission. And if you say it's coming from different areas, different districts across, then it is a statewide or a countrywide community transmission. Right now, in parts, we are in some clusters, we are into community transmission, but it is still not a general situation where every place is in a community transmission. Okay, so let us remember that, and that is where the role of containment zone becomes important. That is again the place where importance of symptomatics, isolating symptomatics, quarantining themselves, ILIs quarantining themselves become important. So all these measures are taken, then these are what will apply. Now coming to the specific question, how does unlock one helps? The issue or the challenge with the government is, do we become so panicked and fearful that we lock down the whole thing and not let anything happen, and then people die of hunger, panic, and then the crime rates go up? There will be a lot of repercussions of that in a society where there is a lockdown and no economic activity happening. Versus, do we prepare and come forward to do essential activities which are important for living, but with caution and without panic? So the essence of lockdown was to, one, mentally prepare us, second, to give our systems time to prepare, and third, uh, the communities also should have and have used that time to prepare themselves. So that was the whole idea. And the concept is in terms of flattening the curve. So you don't want your health system to be overwhelmed. When health systems become overwhelmed, the mortality increases. Right now, we are seeing that there are incidents of high infections among doctors. Even in Hyderabad, this has been reported. So the importance is that health system should be prepared so that these sort of episodes don't happen. And that's where Sri Krishna was emphasizing that private hospitals have taken adequate precautions to isolate areas which are COVID sections and non-COVID sections, keeping everything, segregating everything, staff, equipments, the reusables, disposables, everything has been segregated across these two areas so that there is no crossover. And this sort of system preparedness is important, and that is where the lockdown has helped. Eventually you cannot remain in lockdown forever, and this sort of situation will remain. We have seen the cases have increased, and that is what I have been when I have been speaking with my society and my community members, I've been telling them that we should use this time to prepare, get protocols in place, get monitoring mechanisms in place, get communities, residents to engage and follow this protocol. It is not for one individual. We are either safe together, or one person violates, then all of us are unsafe. So getting everybody together becomes very important in this. And I think that again, unlock will help you do that. So you gradually unlock and you then take one step at a time as you go ahead. Regarding what happens to an asymptomatic person, will he suffer from COVID-19 eventually? Um, and so asymptomatic person could be one who is infected with COVID, or one who is not infected with COVID. The one who is not infected with COVID, there is always a risk that sometimes later there might be infection, until and unless we have a vaccine first and he gets the vaccine. Otherwise, the risk of getting infected will always remain. Over period of time, this risk will gradually come down. Initial period, it will increase, but on a long period, this risk will come down, because as transmission, as more and more people get infected and immunity develops, the transmission rates will slow down. But then there are others who are infected but asymptomatic. So if you test them, the test will come positive, but they are asymptomatic. The science is not very clear in terms of how long does infection provide immunity. Can they get reinfected or not? At the moment, we don't have. I mean, the whole duration of this pandemic is around 6 to 7 months. So if you include the time that has not been reported, otherwise officially it is just, we are just entering into the 6th month. There is still a lot to know about whether there is a possibility of reinfection among those who have been infected and are asymptomatic. Okay. Um, is there possibility that somebody may escape from COVID-19? I hope so. If we take proper precautions, if we, as Samiksha emphasized, it is not about what is happening outside, but it is about what you are doing is more important than what is happening outside. And that is what you can control. That is what you can focus on. So for your own behavior, establish the new normals, practice the new normals, incorporate them into your behavior. And that would be the most important thing. Hemant, any other question?
Hemant, couple of questions. Can I just take them? I saw them earlier.
Yes, yes, please.
Yeah. I think some of them I've already covered. There was one comment, and this is very relevant for the association members. There are different rules at different times. It's very difficult to make it citizen friendly for everybody all the time. The best advice is follow what the government tells you to do. If the government says open the sports area, open it. Don't open it when they say keep it closed. If the government says allow mates, then you allow. Mates, I know for sure, government has put the owners on the resident welfare associations to take a call. So they didn't decide for us. In such cases, you may take a decision and then do it. But as a dictum, if the government has said don't do it, don't do it. If the government has no clear instruction on it, the best way to do it is be as safe as you can. And that way, if you are able to protect the community and you are given the task and responsibility to do it, please do it. And if the government then gives you leverage, for example, Monday onwards, even the temples are going to be open. So now you have every justification to open temple or what. And then heard the Gachibowli Stadium into an interim hospital. I think these have already been answered. So some of the hospitals, additional beds are also being provided. And in the time to come, hopefully nobody needs it. But I think the state government is ready to handle care. What is the concern is how below the threshold can we keep it? And that's basic simple measures active all the time. Then we can ensure that we will be safe. And to add to what Dr. Rajan says, we never know whether we already had it or whether we are going to have it. So watch out for the symptoms, look at the testing criteria, reach out to a hospital on day 3 or day 5. Please consult a doctor on day 1. And if you have any concerns, please call the state helpline numbers. There's a lot of information and people who are stationed there just to answer all your queries. Over to Hemant.
Yeah, Shri Krishna, actually the state government has come up with T-COVID-19 app, and that also provides a lot of information on your phone. So hospitals, both public sector and private sectors, the lab which are testing, the helpline numbers, and other regulatory information, general information. So everything is there on that T-COVID-19 app,
so
which is specific to Telangana.
Use the app. And on Twitter, you have COVID Seva, which can answer all these kind of queries. On the website, you know what is published is there. But COVID Seva on Twitter, COVID India Seva is the official Twitter handle of the government. And they'll answer, do I wear a mask when I run? Do I Can I just move around in my society? They give you answers. So please approach. Very important for us to know what are the right resources and the communication channels which we need to use, and trust them. There's a lot of back end work which happens before that particular information reaches out to us.
Just one clarification. What Sri Krishna said regarding government saying RWAs to take decision regarding domestic help and others to come. The reason is government doesn't know how well are the RWAs prepared. So that is why the decision is left to the RWAs. You are prepared, you have your systems, you have your protocols in place, you can allow your mates, domestic helps to come in. You don't have your systems in place, you want time to prepare, then you don't allow and take the time to prepare. But the fact that government has said it is up to you means from their side, they are allowing it.
Yeah, I think we've been able to cover all the questions, and also for especially for this attendees and also for the communities of L&T and Aparna, please reach out to the hospitals in case you're sick. Don't be afraid to take medical help. Use teleconsultation, which is now valid and available for Continental, AIG, Care Hospital, all the big hospitals around you. They're all available on MFine and also DocSat and their own hospital numbers as well. So please reach out. And if they have a particular process in place, it's up to all of us to have the same process flow which the government is having in place, which is also quite dynamic in nature.
Thank you, Dr. Shri Krishna. Thank you, Dr. Rajan.
Yeah, I'm just I'm just going through some questions. I think which hospitals in Hyderabad are allotted by government. I think that information is readily available on the T-COVID app and on the website, as Sri Krishna said. Who pays insurance? I have spoken about that. Is the patient allowed to carry phone so family can be in touch? Yes, patients are allowed to carry phones. Sri Krishna covered no different protocols for kid. Yeah, I think Gachibowli Stadium has been converted into level 1 hospital, and they are waiting for staffing, as Sri Krishna said. Sri Krishna, Telangana Institute of Medical Sciences, right?
Yeah.
Yeah. So Telangana Institute of Medical Sciences, this is officially, in terms of infrastructure, it is ready. But in terms of human resource, there'll be some time before it gets ready. But
they have shared notification. They have shared notification.
They had issued a notification. I think the government is also getting ready as the situation demands. And the request from our end to all the residents, if you have any health concerns, please inform the association. They are in the best position to help you. The more you hide, the more you put your own family members at risk. If you don't know what it is, by the time you know it, it's probably too late, and everybody else is also suffering. So make sure you reach out for help. Don't panic, but reaching out doesn't mean you have to worry about it. The person who is treating you is in a better position to tell you when to worry.
Can I add few things to certain questions which were coming? There were few questions specifically coming for disinfectant, what to use, bleach solution, hypochlorite solution, Dettol, or alcohol sanitizers. Just want to give you some little detail on this. The alcohol sanitizers which are readily available in the market, and you can also prepare them at your home, are good to use on your hand and lot of surfaces. Bleach solution, where it can be used for floor cleaning or common knobs or desk surfaces, may not be safe to use on rubber material or clothes. White clothes, bleach can be fine, but color clothes, if you want to wash in bleach, if you want to wash your curtains in bleach, so it can destroy. In that case, so you have to think of what material you want to disinfect and then choose the disinfectant. So if you are using it for clothes or curtains or something, Dettol solution, or in fact, not even Dettol solution, simple soaking them in detergent for 30 minutes would be sufficient. The hypochlorite solutions are mostly recommended where you have a chance of high risk contact. Right. In a general day-to-day life, if you do not suspect any high risk of contact in your household, alcohol rub or a 0.1% or 1% hypochlorite solution is suffice. If you have someone who is in quarantine and isolation, There you can see that apart from the alcohol material or Dettol what you're using, for that particular room, that person's clothes, that person's the crockery the person uses. There we can advise that we do advise a normal dish cleaner is also sufficient, but you can prepare a hypochlorite or a bleach solution. Use that solution to clean the surfaces of that person, the isolated area or a quarantined person's room. So just a little bit careful on what material you are using it. Then Krishna and Dr. Rajan have been saying for RWAs to get prepared, and yes, they need to. I want to we could not touch on certain aspects in these question answers, which we can cover maybe some other opportunity, or we can even share more information via email or pamphlets for you. We know that lockdown is opening up and there may be cases coming in our societies. I'm not aware if Aparna has faced a scenario when there has been even a single positive case in the society and how to deal with, because then it becomes not the responsibility just of that household. It becomes a lot of responsibility of neighbors, of the community. If that particular whole building gets sealed, how do you go about it? So when you are opening up, you have also have to plan. If at all there is a positive case in my society and if it gets identified as a containment zone, so how do we deal with it? And start preparing and planning for that beforehand, because in that scenario also it is about helping each other. You just saying that the person will isolate himself is not a solution. And I say that from my experience, because where my parents live, they are elderly, nobody lives with them, and there have been cases where 2-3 positive cases have been noticed in last 1 month and 2 months. It requires everybody's effort in the society to ensure they keep to isolation, their needs are met, their medical and emotional and day-to-day needs are met. At the same time, the neighbors, the contact tracing that would be required, tracing out any other symptoms, mild symptom cases. So just giving it to the community or RWs here, please do plan it. We'll share whatever material we have here for us with us. And there were a few questions on specifically on cancer patients or elderly or children, 0 to 3, 4 to 6. We from IIPHH developed some material, some just pointers for specific vulnerable populations, pregnant women. I think Rajan, we should be okay to share that with the RWAs, because those specific scenarios we haven't not been able to take up in very much detail currently.
Yeah. So if we are, because it's nearing 6, and I don't want people to be unnecessarily be held up. So Sanjeev, Sanjeev, are you there?
Yes.
Yeah. So can we request who will be closing it from Serene County? Is there anybody? You want to say something before that, and then we can.
No. Let me thank all panelists, my team member, Dr. Sri Krishna, and colleagues from Public Health Foundation of India for planning this session and the wonderful question answer session that happened. I'm sure we learned a lot, and I still see a lot of scope in future. What Dr. Samiksha mentioned, that we could take certain scenarios and they are important. So we'll explore further with our resident welfare associations, either as standalone or maybe at a larger platform where more RWAs can participate in the scenario planning exercises. So thank you everyone. And I have Mr. Anand Srinivas, dear friend from Serene County Owners Welfare Association, who is here. And I request Anand to give closing remarks and then we end. Thank you. Over to you, Anand.
Thank you, Dr. Sanjeev and all the panelists, Dr. Samiksha, Dr. Sri Krishna, and Dr. Rajan, and Sri Hemant for moderating this session. on behalf of Serene County Residents and Owners Welfare Association, I would like to thank all panelists and also urge that all residents of both the counties that were covered today, Aparna Sarovar and Serene County, follow the guidelines that were shared on this session today. And I think the summary is that prevention is better than cure, and the more precautions we take, the better off we are. And then in terms of implementing guidelines for RWAs, I would also request as a follow-up to one of the panelists to perhaps maybe share a one-pager that can be shared with the RWA residents, which kind of covers the summary of most of the answers we covered today. So once again, thank you on behalf of Serene County Owners Welfare Association. This is Anand Srinivas representing the county. Thank you very much.
Yeah. Thank you, Anand. Thank you, Nagaraju Garu, Sita, who actually initiated the whole thing, and Lata, because of whom I came into contact with the Welfare Association. We just were having a chat one day, and then it all spiraled up that we need to prepare, and then we started thinking about this. So I would now want to close. There may be some questions which have not been answered. What we will try to do is we will try to, as Mr. Anand suggested, try to put a one-pager and try to take these Q&As and develop them as RWA Q&As, and then put it on our website, both on the UNICEF and PHFI website, and share with you all through mail, so that it is a ready reckoner available to everybody. Okay, so thank you everyone, and shall we close now? Yeah.
Yeah.
Right.
Thank you, everyone.
Yeah. Thank you.
Thank you, everyone.